Hi, my name is Laura Friedberg, and I will be presenting on the topic of otitis externa. Today we will be looking at the case study of Jay. Jay is a 16-year-old teenager on a swim team. Jay complains of right ear pain that worsens at night, and the pain intensifies when touched and complains of a feeling of fullness in the ear. Jay goes to see his doctor and is diagnosed with otitis externa and is given eardrops. So what is otitis externa? Otitis externa is the inflammation or infection of the external auditory canal, also commonly known as swimmer's ear. This often occurs more in adults than in children. So what causes otitis externa? The ear or external auditory canal has natural flora in it, which can cause otitis externa. Also, an alteration of the cerumen, which serves as a protective barrier, can cause this as well, by altering the pH, which usually prevents bacterial and fungal growth. Other causes include, occasionally but rarely, fungal growth, trauma, such as itching or scratching, inserting objects such as cotton swabs into the ears, or even digital trauma, skin inflammation and edema, and moisture. In this case, Jay has swimmer's ear, which can be caused by heat, humidity, or moisture in the ear. The moisture traps the normal bacteria as well as alters the pH of the ear and removes the protective cerumen layer, making a perfect environment for bacteria to grow. Anatomical differences can be a hairy ear canal or narrowed canal that can cause wax or debris to accumulate in the ear, which leads to moisture retention. Examples of chronic dermatological diseases include atopic dermatitis, psoriasis, and seborrheic dermatitis. Individuals who are immunocompromised, like on chemo or with HIV or AIDS, may also be susceptible to otitis externa. By keeping the ear too clean, the protective layer of the cerumen that serves as a barrier is also altered. Otitis externa can be localized or generalized. It can be acute, lasting less than 6 weeks, or chronic, lasting more than 3 months. It can even be necrotizing or malignant. In chronic cases, hearing loss can occur and stenosis of the external auditory canal. In necrotizing or malignant forms, this can cause destruction of the temporal bone. This is common in diabetics or those that are immunocompromised and can become life-threatening. Signs and symptoms of otitis externa include pain, inflammation, fever, and feelings of oral fullness. Otitis externa can be treated using non-pharmacological or pharmacological treatments. Non-pharmacological methods require ear cleaning, removal of any debris by a microscope, and avoidance of causative factors. Most otitis externa are treated with pharmacological treatments, such as topical or oral antibiotics. Amoxicillin is a commonly prescribed antibiotic for an acute case, such as Jay's. It's the first-line drug that is prescribed. If the symptoms persist after 48 hours, amoxicillin carbonate enhanced strength is used, but has an increased risk of causing diarrhea. Alternatives are cephalosporins, such as ceftinar, cefuroxime, ceftriaxone, and ceftriaxone. Common side effects include nausea, vomiting, and diarrhea. If symptoms persist after 48 to 72 hours, the patient should be reassessed for other possible causes or other treatment options. The following slide is a step-by-step presentation for Jay's parents on how to administer the topical antibiotic drops. Hi, my name is Laura Friedberg, and I'm doing a presentation on how to apply ear drops. So the first step you're going to do is you're going to wash your hands or use hand sanitizer. You can have the patient do this as well. The next step is you're going to take your prescribed ear drops. You're going to open the bottle without contaminating the tip. And then you're going to have the patient lying down with the affected ear facing up. So the next step is you're going to apply the drops And again, you don't want to touch the tip to the eardrum so it doesn't get infected. For adults, you can pull the pinna up and back, and you're going to apply the prescribed amount. If no amount is prescribed, you're going to put them in until the ear feels full. To help get the drops in, you can move the pinna back and forth. And then after you put the drops in, you're going to have the patient lie in this position for a few minutes to let that drops absorb. If the patient needs to have drops in the other ear, wait until those drops have absorbed for a few minutes and repeat the steps again. Thank you. So how can we prevent otitis externa? Prevention can happen by drying your ears after you're swimming, using a towel and never a cotton swab. This will be very important for Jay. Avoid swimming in polluted waters. Using earplugs is another option. There are also prophylactic drops that are a 1-to-1 solution of white vinegar and 70% ethyl alcohol that can be used before and after swimming. Do not use cotton swabs to clean or dry your ear, and you can periodically have a specialist clean your ears. And this concludes my presentation on otitis externa.